Hi, I'm Dr. Aliabadi. If you struggle with irregular cycles, acne, facial hair, body hair, hair loss, or insulin resistance, you might be dealing with PCOS, or Polycystic Ovarian Syndrome. Having dedicated my life to helping women with PCOS, I understand the challenges in getting an accurate diagnosis and the right care. That's why I created OV. OV is designed to help you take control of your health with clinically proven, validated ingredients in a simple, once-a-day solution. For too long, women with PCOS have had to choose between lifelong prescriptions or complicated supplement regimens. OV offers a better way to help manage your symptoms without the hassle. It's my mission to empower women facing PCOS and other hormonal issues by providing the information and support they need. Reclaim your health once and for all. Go to OV.com. That's OVII.com and start today.
Okay, so today we are so lucky to have Florence Pugh. She is a Academy Award nominated actress. She's a badass. She's one of Dr. A's favorite patients. And we're going to delve into PCOS, body positivity, and everything amazing about this incredible woman. Florence, we are so thrilled to have you on the podcast. When I'm watching you on Oppenheimer, Little Women, you name it, it's like you have this light from within and it's impossible to turn away. And Dr. A says that about you in person. So I'm just so thankful that I get to meet you today.
That was quite the intro. Thank you very much. My cheeks blushing.
And where are you right now?
I'm in London. And my dog might be trotting around in the back of this podcast quite a bit, but she'll be sleeping in a minute. So if you hear a snore, I'm sorry.
That's okay. We have big old Bernese Mountain Dog whiskey comes flying in here half the time. He ruins most of our takes. But
I love that.
He's the best. Can we just talk about how y'all met? Has it been a long time?
No.
Why don't you go ahead?
It really hasn't. It's been about a year. And we met through our good friend who kind of put us in contact with each other. I was trying to think before I signed on to this call, like what was A, the most important thing, but B, the just time of it all. It's just really not in our culture here in England to be having a gynecologist that you go and check frequently. And to be worried, I guess, before you need to be worried. And so when I had a bit of a worry last summer and I just wanted to go and get things checked out. And then we ended up finding out information that I probably wouldn't have known until I started having kids in another 5 years. So it was kind of amazing how we met. And then also you then get to meet a person that you completely vibe with and completely trust, which I'm always grateful for.
And so are you comfortable talking about what that was? Because, what we do on this podcast is we're so grateful to have women like you who have this platform that help educate other women who maybe don't have the same opportunities to be able to go to Dr. A. And so I think everybody's grateful just to even have you talking about something so personal.
Yeah, I wouldn't probably discuss any other funny things that I've found about my body, but I do truly, my life has completely changed since finding out this information. And in a great way, because it means that I have to really be on the ball and I have to really wake up and take it a bit more seriously than I would have done. But I'm also learning a lot now, and I've learned a lot through Thaïs, and I'm clearly learning again because when I saw you recently, you educated me on a whole new level. And it's meant that I've been able to tell my friends about what I'm going through, tell my siblings what I've been going through. And since then, I think 2 or 3 of my friends have gone to go and get checked because of my findings. And they've also found that they have the same thing. So already just by me learning the tiniest bit of information that Thaïs taught me, it's led for other women to go and check to see if they also have the same. I completely understand why you do this podcast, and it's an amazing thing. And I, when Thaïs asked me, literally just a few months ago, I said yes before she finished the sentence. Well, I'll just quickly fill in on how weird it was. I just had this sudden feeling that I should go and get everything checked. I'd had a few weird dreams. I think my body was telling me, and I then asked my close friends if they knew any amazing gynecologists. And then I met Thaïs and I went in and she asked if I'd ever had an egg count. And I was like, no. What do you mean? I'm so young. Why do I need an egg count? And she did an egg count and pointed out exactly what I had, that I had PCOS. And that also probably due to all of the pain that I've been in since I was like, well, not anymore because I had the coil, but the pain I do have was also endometriosis. So it was just so bizarre because my family are baby making machines. My mum had babies into her 40s. My gran had babies throughout. I mean, she had so many kids as well. I just never assumed that I was going to be in any way different and that there was going to be an issue with it, or that I had to think about it before I needed to think about it. So I guess I just was never worried because my mum was her way and my gran was her way, and my older sister also had children later into her 30s. And so it just really wasn't a red flag for me. It wasn't a worry. And then, of course, I learned completely different information, age 27, that I need to get my eggs out and do it quickly, which was just a bit of a mind-boggling realization. And one that I'm really, really lucky and glad that I found out when I did, because I've been wanting kids since I was a child.
Did you know what PCOS was before? Had you ever even heard of it?
No. I'd heard of it. I didn't think that it was something that is common. I really just thought that it was something that you'd feel and that you'd know you kind of had, and that it wasn't really a worry. And then, of course, you find out you do, and you realize you have to change your lifestyle, and you have to figure out when you can be proactive and think ahead into the future, which I think for lots of young women, that's not really necessarily what you're thinking of doing when you're in your 20s or even younger, as Thaïs was explaining to me.
Yeah, when you're young. So explain about the egg count.
So when she presented to me, she gave me this long history of painful periods. And luckily, someone, I think in London, put a progesterone IUD in her, which helped relieve a lot of her symptoms. So endometriosis, when untreated, in her case, it was treated. When left untreated, it can affect your egg count and quality. And I had diagnosed her on that day with polycystic ovarian syndrome. So PCOS patients have a lot of eggs, but the quality goes down after 30. Endometriosis can lower your egg count and quality. So when you have a patient with both possible diagnoses, you want to see where that egg count sits. And anyone, for my patients, when they get to about 28 and they have PCOS or endo, I start having the conversation about egg freezing with them. They might not need to do it right away, but I've had endometriosis patients. I have a 16-year-old in my practice with an egg count of 1, which is an egg count of a 35-year-old. And I'm going to send her for egg freezing in 2 years. That was not the case in her case. And I think mostly because her endometriosis was suppressed. She didn't know why she was having all those painful periods. And there's a very big link between PCOS and endometriosis, PCOS and painful periods. So, usually when I have patients that I diagnose with PCOS, I always look to make sure I'm not missing endometriosis in them. In Florence's case, she was suppressed already on progesterone IUD and she was doing better. So there's nothing else we needed to do. But given her age, given that I think she told me she wants to wait another 5 years for a baby. So I told her, if you were my daughter, I would absolutely have you freeze eggs.
So when you were growing up, because PCOS starts when you get your period and you have it for, a lifetime. So you're really dealing with your symptoms, and a lot of that is infertility. And then you talk about how a lot of the patients come in, they have eating disorders, they have, acne, there's all these symptoms. Did you have any other symptoms other than you just happened to go to Thaïs and had painful periods?
When I was a teenager, I went from being someone that didn't even know that I was on my period. And all of the girls in my year would be very irritated because they'd be obviously on their period for like a week and I wouldn't have a clue that I was on for a day. And then it changed when I was 16 from not knowing I was on to suddenly I was on for about 2 weeks and then off for a few days and then on for about 2 weeks. And I was dancing a lot at the time. I was acting a lot of the time, and I was just bleeding and in so much pain, and it was not something that I could keep up with. I think I just started having my first relationships, and my mum was very keen on trying to figure out a way to solve loads of these problems. And so I ended up getting the coil when I was 16. And so I think that obviously definitely masked me knowing about my body for a long time, which is what Thaïs was explaining has kept the endometriosis at bay. But in terms of were there any specific things or signs, yeah, I had acne. I definitely have like hair that shouldn't be in certain places. But I just thought that that was part of being a woman and also living a maybe slightly stressful life. Like I didn't think that constant weight fluctuation would also be a part of it. And I'm someone that has never been the same size in my entire life. I've always gone up and down and up and down. And it's never really been something that I've been hugely like fussed by because it's always just been a part of my life. And I always eat well and I exercise. And I just considered that was because, you know, I have a curvy body and my mum has a curvy body and my sisters have curvy bodies. And that's just the way that we are. But understanding recently what Thaïs was educating me in our last meeting was that, no, that's also heavily influenced with obviously having PCOS, which a huge revelation to understand that there was a reason for that. And also to understand that I can help it and I can, in some ways, I suppose, learn alongside it and also try and help myself and help my body rather than just thinking that this is a thing that I have and I guess this is just the way that it is now.
You know, one of my biggest dreams in life is to catch every teenage girl with PCOS because of that body image issue that they have. PCOS patients, generally speaking, have mood disorders. They tend to be a little bit more anxious. And compared to their friends, they eat the same thing and sometimes they have a harder time losing it. So the combination of the two, not always, but a lot of times pushes them into a path of an eating disorder. And my dream is to bring awareness to all these pediatricians who see these young teenagers every single day in their life. But in reality, a lot of them have an underlying condition that explains these symptoms. So that's one awareness I want to bring. I always say it doesn't have to be an eating disorder. It could be a disordered eating, and it's your relationship with food. And when you compare yourself to, let's say, at age 17 to another 17-year-old who sits in front of you and eats everything and shows up the next day skinny. I was one of those girls. I would go to Cheesecake Factory with my husband and I would have 7 cups of Coke, you know, and my friends would look at me like, how do you do that? And I could eat pasta and pizza and chocolate and ice cream and nothing would ever happen to me. But I had friends who couldn't do the same and couldn't even have half a Coke at the time. And back then I didn't understand why. You know, I used to say, well, my dad was skinny. I'm like my dad. But I couldn't explain it. But I see it in my patients, especially the young ones, how much they struggle with their weight. Sometimes they're not even overweight. It's just that fluctuation that makes them so frustrated. Did you experience anything like that when you were a teenager?
Well, I think I always thought that just people have different bodies and obviously they have different shapes and they come from different shaped parents. And that's also an element of how your body will kind of, I suppose, grow through those teenage years. But what you were explaining to me the other day was hugely insightful of how, like, my body doesn't break down insulin. And that was just a whole new understanding for me. Did I have times when I was a teenage girl where I fluctuated weight? Yes, I did. I just think being a teenage girl is so scary and there's a lot that you feel is coming after you. And one of the things that I, especially after finding this out with you, is, you know, we ask young girls to keep mindful of the lumps in their breasts and stay mindful about anything that may feel particularly strange there. But we just have no education on looking after what is going on inside us and the things that we can't see and the things that we can't feel. And I feel so let down by the lack of conversation. I feel so let down for all of the young women that are going to find this out far too late and are going to find this out when they start to have children in their 30s and they've had a really amazing 10 years of work. And I feel like this is such a simple conversation that we should be having when we start our periods or when we start having sex. Like, it really, really should not take this long for someone to find out about this diagnosis that they have no idea what it is. And part of that is what you're doing, which is brilliant, is talking about it and making it really, really normal to discuss these things so that other women can go and have themselves checked out. I remember when I was 13 or 12, I was at a girls' school, and the whole school got their cervical cancer injections, and we had to have 3 in 1 year. I remember at the time, my mum was so excited and so amazed that, obviously it was a school run by women, and these women really wanted all of these girls to be safe. Something like that needs to be the equivalent of us talking about our reproductive systems and what's going on so that we can be mindful and be aware and also educate us. I mean, it wouldn't be that hard to educate everybody on this when you're at school. It's something that will be the defining factor of whether you can have children or not.
It's so true. And, majority of patients go through life, never get diagnosed. Fertility clinics are packed with these PCOS and endometriosis patients, and no one ever talks to them. I remember this time when I saw you, can you share what your doctor said back home when you went to see her and talk to her about PCOS and endometriosis? Will you share that visit? Because that is what women go through every single day. And you're Florence Pugh. You're not some random girl like the rest of us. So if this is happening to you, other girls have no chance.
I hope that it should never make any difference who you are.
But you have access. But you have access.
Yeah, you're right. You're right. I have privilege in areas where others won't. I'm definitely not shutting that down. I went to another gynecologist and I just needed to go get a check. I'd come back home and I wanted to make sure that I had like a good, safe person here. And when I went, I told her about the things that I'd found out through you, and she shook her head and she said, well, that's just not possible. And I said, what do you mean? She goes, you don't have PCOS. And I go, I do have PCOS. My gynecologist in America, she showed me when she was counting my eggs. She was like,
and your hormone test.
You can't.
And your
yeah, and endometriosis. And she said, no, you can't possibly have that. How old are you? And I said, 27. She goes, no, you're fine. And even if you do have it, you'll be fine to have kids well into your 30s. I remember when you discovered that I had PCOS, you made me listen, and you calmed the pace of the room down, and you gave me instructions of what I needed to do in the next 2 years and how I do need to take this seriously. And if I take it seriously now, I'll be safe later on. But that you really made me listen to the thing that I needed to learn about myself. And
be your own health advocate.
I got shut down, told that I was essentially making things up, and that my gynecologist in America was making things up. And that even if I did have it, I shouldn't really be worried. And when I remember when I told you, you started tearing up. You said, I think I'm going to be sick. That's exactly what I spend my career fighting against. And someone has just told you that you don't need to worry about the thing that you actually have. I mean, obviously, there's always going to be different opinions with different results from different doctors. But when it's something that is that dangerous to give that kind of opinion to, that to me just proves that the conversation isn't loud enough. It isn't taken seriously enough. It should be really common to talk about stuff like this, but it's obviously because there's a lack of information and a lack of sharing information that it means that's possible.
Well, I think it's education. I mean, 75% of women don't know that they have it. And
I think that number is 90%. I swear to God. That's all I see. I see PCOS. I've seen PCOS every single day of my life since I opened up my office. So how could that be 75%?
Exactly.
It's 90%. The problem with PCOS is even when they come in with the diagnosis, they haven't been treated.
Yeah.
So I get so excited when someone comes and says, my doctor said I have PCOS, and I've learned more and more. Like this past maybe, I don't know, 4 years, more and more people are coming. Every month, I feel like it's getting more, partly because of patients like Florence who share their experience. That's why when she told me her doctor in London dismissed her, I begged her. I'm like, you see what I've been fighting against.
But we get dismissed all the time. And that's why, I've had this dream for many, many, many years to have a platform where patients can go in and basically, without needing a doctor, I put a calculator on it. Basically, it's a risk assessment for PCOS. Just like there's a risk assessment for breast cancer, I created a risk assessment for PCOS. And by answering 10, 15, 20 questions, we can't diagnose anyone, but it will tell them whether they're likely to have it or not. For the past couple of years, I've worked with this amazing scientist. He created this powder for OB, and this powder will completely change the lives of these PCOS patients, because the main issue with polycystic ovarian syndrome is insulin resistance. They have irregular periods. They have high testosterone symptoms because of that insulin resistance. So I created a powder that's not only anti-inflammatory, the efficacy of it is very close to taking a full dose of metformin without obviously the GI side effects, the diarrhea, the nausea, the vomiting. It hopefully will help PCOS patients ovulate. A lot of these lean PCOS patients who are not overweight, 25% of PCOS patients are not overweight. Even these patients can have anovulatory cycles. So by fixing their insulin resistance, you can help the ovulation. So lean patients actually do really well when you put them on metformin before trying to get pregnant. So I always tell patients, if you have PCOS, you are going to get pregnant. We know how to help you get pregnant. But if you can't get pregnant, you can try this powder, go to your doctor, get metformin, and try that first before you go see a fertility doctor. Because a lot of times when you end up in the fertility clinic, it turns into a very expensive IVF cycle. The other point I want to make is PCOS patients have a lot of eggs, but the quality goes down after 30. That's why egg freezing and the discussion of egg freezing is so important. And even, my daughters, when they were 16 and 17, I checked their egg count. So it's a quick blood test. It's called AMH. You can do it anytime in the month. You can go to your doctor, check your egg count. And if it's low, you can start having the discussion of egg freezing as early as 18. But if the egg count is good, you can watch these patients. But by 30, I would say definitely start thinking seriously about it.
Okay, Florence, I can't have you on my podcast and not be able to ask you about your fashion. Your red carpet moments are like love letters to women embracing their bodies. I was a fashion designer for years and years and years before we started this, and was a stylist and a magazine editor. And so I am entrenched in fashion. But every single time you come on the red carpet, it's like a wow moment. And Thaïs doesn't even probably know this. So she's talking about her PCOS calculator and the powder. It's called OVII. But when we were doing all of our branding and packaging, I have a picture of you in the purple Valentino that you wore. I think it was to the couture show, and I was like, "This is it." I go, "This is the color," and that's our whole branding color. So when you see OV packaging, you're going to be like, "That is your dress." Like basically, I was like, "No, I know," but
crazy.
But I want to say this because you have been such an advocate. I mean, I want to even say you also wore this other beautiful, I think it was Valentino pink. It was like the salmon pink. You wore that one, and there was this like almost nipple gate when you came on the red carpet, and you had this sheer. And by the way, let me just tell you, I have shown my nipples. I'm now 53, so my nipples aren't up where they used to be. But I used to like wear every sheer thing. I was like, "This is gorgeous. Look, I mean, I have body dysmorphia, the opposite. I'm literally like, I'm the hottest person." But it was this crazy thing. I know Thaïs has no idea what I'm talking about, but there was this really big moment where on the red carpet, you had this stunning dress, and it was a little sheer, and you could just see basically her nipple. It wasn't like she had her, your nipples weren't hanging out. They were just, this very sheer. So you've been really an advocate of body positivity. And can you just talk a little bit about that? Because I think having, again, growing up, all of us have some sort of eating things when we were younger that we have to kind of go, get over. But to then go to be this real, voice and advocate icon for it is incredible.
Yeah, I think it's definitely a relationship that I have had, obviously, with my body for a long time, but I think especially in this industry that is constantly changing and growing. But I think when you have lots of people that are
up in arms by you feeling comfortable and confident in your own skin, I think it only gives you more petrol to keep going. And for me, I've always been in this body with hips and small boobs and big shoulders. And that's just the way that it's always been. And my mum has always done her very best to teach all the women in our family how to feel beautiful, no matter if your body doesn't look the same as the woman looking next to you. And I've always loved that sentiment. You know, like true beauty is something that shines out of your chest. It's not necessarily anything to do with where you get your hair done or, you know, what Spanx you wear. It totally comes from within. And it's definitely a wrestle that I've had for, you know, I mean, as I just said earlier, teenage girls going through what you go through is just so rough. And I've just tried to be as authentic and as me as possible throughout this journey, because there are so many people watching and so many cameras at the ready to watch you fail. And I've just really wanted to enjoy this journey. And through that, I've ended up getting my nipples out a couple of times. You know, that's another thing. Every single time I do something like that and I feel comfortable and I feel gorgeous, I do really also feel the love and the energy from women that want to let me know what that made them feel like. And I am also hugely appreciative for that and for hearing how it changed the way that they see their body or made them want to get that part of their body out that they didn't think they had confidence for before. It's definitely funny when people get angry at me for being comfortable in my own skin.
And I loved your response. Your Instagram response was amazing. I mean, all this
I know.
blah about, you know, it was...
I know.
Yeah, she responded in this really positive, amazing way. She's like, you know, wait, I think I have it. Hold on. She said, listen, I knew that when I wore that incredible Valentino dress, that there was no way there wouldn't be commentary on it. Whether it be negative or positive, we all knew what we were doing. I was excited to wear it. Not a wink of me was nervous. I wasn't before, during, or even after now. See,
Bravo.
She just was like, and there was a lot more to her response, but it was just like, and all because of two cute little nipples.
But it's because of that you also on this podcast. Do you know what I'm saying? You're standing up for women around the world. You're saying it's okay. It's okay to be confident. It's okay to be comfortable in your body. It's okay to share that not everything is always perfect, especially when you're a celebrity. In this world of social media that my children are watching every single day, everyone is quote unquote perfect. That's how teenagers see you guys. And I'm sure you know that.
know, and it's so frustrating that though. Like, I think that's the thing that needs to be slightly knocked down in some way. It's a false reality. We all know that on our phones. It's completely false. And whether I am posting a beautiful moment on a red carpet, it's also really important to credit all the people that spent 2 hours to get you ready, because it is not real. And I do not wake up looking like that. And the day is not real. It's a bizarre, special wedding-like day. You have this beautiful couture dress that for me, you know, has mostly been Valentino, and they completely embrace my shape and size. The whole day is not normal. And so it's so important, even when you do have to post those unbelievably bizarre moments, you have to credit that this is not normality. And there is a lot of people that have made you look like that and feel like that. And yeah, these phones are terrifying. And there's also a lot of love on there. But yeah, I've always been conscious and very, very aware of what young people are learning from these false lives that we put out. I've tried my best to not sell a life that isn't real. And my sister is 7 years younger than me, and I've always been very conscious of what her friends are looking up to me as and what she is looking up to me as, especially going back to our conversation of why we're here. At the end of the day, we are all humans. And I have eggs that I didn't know needed some looking at. And take away from whatever fame is or celebrity life is or whatever Instagram shows you, ultimately, there are things that need to be checked. And if you have a dream of maybe one day being a mom, these things are so important, much like learning how to find lumps in your breast.
Oh my God, my heart will explode. It's because of you that I wake up every day and go to work. You're incredible. Thank you. Thank you. Thank you for being so raw, for being so honest, for using your platform. You're going to help millions and millions of little girls.
Before we jump off, everybody wants to know, what do you do to wind down? What do you do to work out? How do you keep yourself healthy now?
It's always changing. And I really like that about growing up. I'm not mad at myself for not finishing the run anymore. I'm really just trying to enjoy what my body is asking for and what my body needs. Like when I was younger, I'd get so upset that I wasn't fit enough to run around the park twice. And so I would do it and like harm my body. And now I'm just, I'm on a walk with my dog, and if I want to run, I run. If I don't, I don't. And then I'll stop and do some squats, and maybe I won't. I really like just listening to my body at the moment. And what do I do to wind down? To wind down, I'll cook. I love cooking for myself, whether it's just me on my own or if I've got friends coming around. I love my quality time with my dog. We genuinely just cuddle on the sofa and watch stupid TV. And what else do I do? Go on walks. Maybe sometimes do some crunches. I don't know. I'm in a portion of my life right now where I'm listening to what I actually want to do, as opposed to guilt tripping myself into decisions that will maybe one day make me feel good. But actually in the moment I'm hating myself for it. I'm in the mode right now of listening, which is a really, really hard skill to do. You definitely have to go through a few learning blocks to do that. But I'm liking it. I'm like listening to my body. I'm usually not very good at it, but I'm nailing it at the moment.
And then right before we go, again, like you just can't turn your eyes away from you when you're on screen. Is there a project that is dear, like that you've loved working on that you could talk about?
There's loads of projects that I've loved being on. I just came off a really, really beautiful experience working with a whole handful of incredible cast on my next Marvel movie called Thunderbolts. And it was truly just the most beautiful experience with some really, really fantastic people. So that's kind of started my year off, and I felt really good about that. And then where I'm going next is I'm going to go and shoot a series called East of Eden, which is based off the book. So that's very, very exciting.
That's amazing. Well, you are literally, I can't thank you enough for sharing your journey with PCOS. And endometriosis. You're going to help so many people. And you are as gorgeous on the inside as you are on the outside. I just think you should know that.
Thank you. Well, I'd also just like to say to you guys, like, this wouldn't be possible without your platform and without your podcast. I'm very grateful that I met you last year, Thaïs, and I'm anything to give back was always going to be. So
I love you. Honestly, this is the best gift anyone can give me. People send me flowers and gifts, and I always say, don't do it. If you can bring awareness to PCOS and endometriosis or breast cancer, that's the biggest gift. If you were here, Florence, I would hold you in my arms.
Oh,
This is the first time I've cried on my podcast.
wow, that's huge.
I do, because I'm like, look at you. You didn't have to do this.
No.
I ask a lot of people and they tell me no. So I get so emotional because I know what an impact you will have.
She's thank you.
And give her a hug for me.
I'll give her a hug for you. I know she means it. She means it. You are incredible. So thank you so much.
Oh, babe.
She's crying. This is our first podcast that we don't do visual, but
I wish I was there to give you a hug. Thank you so much for saying that. And thanks for also changing my life.
wow, what an incredible episode. Thank you so much, Florence, for using your platform to help other women educate themselves and be their own health advocate. This episode is going to change so many lives. For more information on PCOS and endometriosis, go to shemdpodcast.com and review our show notes. We also just launched OVII.com for PCOS and hope you will join our mission to change the world of women's health. Thank you so much for listening.
If you want to own your own health, a good place to start is by following us on social media at SheMD Podcast and by subscribing to our show on YouTube or wherever you get your podcasts.
We'll see you next time on SheMD. This podcast is for educational and entertainment purposes only. It is not intended as a substitute for a physician's medical advice. You should regularly consult your medical provider in matters relating to your own health. Even though we share our honest beliefs on SheMD, some of the products and services we discuss may involve sponsorships or paid advertising.